Hi everyone, this is Dr. Praveen here. Today I am going to talk on the Kukkutanda Twak Bhasma. Kukkutanda Twak Bhasma is prepared out of the shell of the egg, particularly hen's egg. Kukkutanda Twacham Shuddham Sukshmam Vichurnitam Amla Dravya Bhavitam. After washing the eggshell, it has to be powdered, and afterwards Amla Dravya Bhavita means it has to be treated with the acidic property medicines, and afterwards it has to be taken for the Bhasmikarana. These Bhasmikruta tablets in the form of Kukkutanda Twak Bhasma tablet can be used for the treatment in two purposes, as a calcium carbonate supplementation as well as to treat the Amla Pitta. The classical reference of Kukkutanda Twak Bhasma indications are Ajirna, Amla Pitta, Gulma. When it combines with the HCl, calcium carbonate is a rich source or main ingredient which is present in Kukkutanda Twak Bhasma. When it combines with the HCl, it releases CaCl2, calcium chloride, and H2O and carbon dioxide. It releases the carbon dioxide, hence the patient may feel bloating of the abdomen after having Kukkutanda Twak Bhasma when you are using it to treat for the Amla Pitta. It is a very good neutralizer of the stomach acid. The second indications of Kukkutanda Twak Bhasma is as a supplementation, calcium supplementation. We get a different forms of calcium supplementation like calcium carbonate, calcium phosphate, calcium citrate. But bioavailability is very rich in calcium carbonate, that is 40% of the calcium carbonate has elemental calcium. If you take 100 grams of calcium carbonate, in that 40 grams of calcium is available, that is elemental calcium is available. If you take the other sources like calcium phosphate, calcium citrate, the bioavailability of the elemental calcium is lesser than the calcium carbonate, like 38 and 25 respectively. As I told, the indications are Ajirna, Amla Pitta and Gulma, but these Shuddha, if you take the Shuddha Vargiya indications of Shuddha Vargiya drugs, he said that Shuddha Vargiya Dravyani Asthi Danta Pramashtakarani. As a for the supplementation for the bone, you can use the Shuddha Vargiya drugs. Kukkutanda Twak Bhasma is used, Kukkutanda Twak Bhasma tablet is used for the to treat the Amla Pitta and as well as for supplementation. Then what is the dosage of Kukkutanda Twak Bhasma to treat Amla Pitta and as well as a nutrition supplementation? See, based on the severity of the Amla Pitta, you can decide the dosage, but as for the supplementation, as you know, the normal supplementation required per day for per person is 1000 mg of the calcium, elemental calcium is required. But we have seen most of the conditions treating with the calcium like Shalcal, most popularly known medicines, so hence I am taking the name of the Shalcal. Shalcal is having 500 mg of elemental calcium, which is also in the same form, calcium carbonate. Why we prescribe 1 OD then? See, even though the requirement is 1000 mg, but simultaneously in the food also 5 to 600 mg of calcium is very easily available. Means 1 glass of milk has nearly about 150 mg of calcium, roughly I am telling. Hyper supplementation of the calcium may cause constipation and bloating of the abdomen as well as some other complications like urolithiasis and all. Hence, usually they give 1 OD, even though the requirement is 1000 mg per day. The usually therapeutic dosage 500 mg. Based on the severity and the patient condition and supplementation, you can change the dosage also. In the market, the Kukkutanda Twak Bhasma tablets are available in 250 mg of calcium carbonate. See, please pay some attention. These are 250 mg, each tablet has 250 mg of calcium carbonate. To meet 500 mg of elemental calcium, because as I told, 40% is only the calcium and the rest of the 60% is the carbonate or some other things. So in Kukkutanda Twak Bhasma, and 95% of total tablet will be having the calcium carbonate. Hence, you will roughly take it as 100% of calcium carbonate. One tablet has 250 of calcium carbonate. To reach 500 mg, so we roughly require 1250 mg of calcium carbonate to reach 500 mg of elemental calcium supplementation. Hence, I can say that we require 5 tablets per day. 5 tablets means one tablet is 250 mg of calcium carbonate, 2 tablet is 500, 4 tablets is approximately 1000 mg of calcium carbonate, and 1250 is the approximate tablet required per day to supplement 500 mg of elemental calcium. So if you wanted to give a full 500 mg in a single dose, what you can do, you can advise 5 tablets with food. Why with food? See, it has to be taken along with the meals. Better action in the presence of acid. Once it neutralizes, again when it gets neutralized, then the bioavailability will get decreased. Along with the food, you can advise the calcium supplementation. Treating amla pitta and all also, you can ask the patient to take before food. And when you are giving it for a supplementation, before food or along with the food only you can advise, not after the food. After the food, HCl get neutralized and it requires HCl to disintegrate to give the calcium suppression in the form of calcium chloride. So, or else we can give 2 tablets in the morning, 1 tablet in the afternoon, or 2 tablets in the night, or 2 TID also we can give when you are giving it for the supplementation. When you are giving it for the treating the acid peptic disorders, then you can give the 1 TID or 2 TID based on the severity of the symptoms and response of the patient. This is about the Kukkutanda Twak Bhasma used in treating amla pitta and for the nutrition supplement, means for the calcium supplementation. If you have any doubts regarding the Kukkutanda Twak Bhasma, then kindly write in the comment box, and if you like this video, then kindly forward to the needed people. Thanks for watching.